Yeah. So Dr. Anjali Khadia, she would be speaking on an innovative way in teaching examination of strabismus for residents, and Dr. Rakesh Shakya would be discussing.
Good morning, everyone. My presentation is an innovative ways in teaching examination of strabismus for the residents. I have no financial disclosure here. So, learning sensory and motor examination of strabismus need time and practice, and it is difficult and not always possible to teach the concept with the real patient. So, we demonstrate sensory and motor adaptation examination. First, to know how to make prism into strabismus. This is the orthotropic eye. So when is basin is prism is placed before the right eye retinal image that is displaced nasal to the fovea, and due to the Hering's law, left eye moves nasally as image displays nasal to the fovea. With the help of, we demonstrate the strabismus examination. First one is the red glass test. This is the red glass interpretation. And when base in prism is placed, we making the isotropic, we see the homonymous diplopia. And when the base out is prism is placed, then we making the exotropia, we see the heteronymous diplopia. Similarly, for the base of prism, we see the normal retinous correspondence. Second one is the Maddox-Rod test. Maddox-Rod test, this is normal Maddox-Rod. There is the point source of rise is become the straight line according to the placement of the Maddox, whether it horizontally or vertically. And when the base in prism, obviously that is the uncrossed image, and base out, which is the crossed image. And third one is the Begolini striae glasses. This is the interpretation of the Begolini striae glasses. This is normally we see, this is the orthotropic eye. And when we one eye is occluded, obviously we see the one image, and there is the suppression eye. And base in prism is placed, making the isotropic. We see the image will shifted one side, same side, and both prism is placed in the base in. Then we beautifully see the V pattern. And when the eye is making exotropia, we see the opposite side image, and base out is prism is placed. We see beautifully A pattern. Fourth one is the after image test. So it is very simple to test. So it is the torch light with black paper. It is the horizontal slit, the 2.5 millimeter in the diameter centimeter, and 0.25 it is the width. And central tape is to protect the fovea. First one is stimulated for the vertical slit, then followed by the horizontal slit, and then for the 20 second, and then close in eye, both eye, or just open the eye in the dark room, so that we see the beautifully this normal retinal correspondence. We induce the isotropic or exotropic base in, base out. We see similar image, but we are not able to demonstrate the ARC, abnormal retinal correspondence. So we did the study. So study group better performance after this evaluation. And coming to the discussion, this is the subjective assessments, and examiners feels the real appearance of the examination of the strabismus patient, and it will train the residents without a specific stimulators. So here I'm conclude that it allows the residents to examine and diagnose the strabismus. And we can also demonstrate diplopia in a HChat, but only for the paralysis, paralytic horizontal paralysis, not for the vertical strabismus. Thank you.
Thank you, Dr. Anjali. Before Dr. Rakesh discusses, I must congratulate you. This is the first time I'm seeing strabismus coming up on innovations. And personally, I'm very, very happy to see that there are people in our specialty also who are looking to bring about innovation. Dr. Rakesh, please.
Yes, a very congratulations to actually very good innovation. And my question is, some pediatric patients are very irritative. So can we do in this type of patients this examination?
Children is very difficult, sir. Less than 10 years, but above 10 years, patient is cooperative, then we can do, obviously. There is no problem. It is only for the PG students, for the know the experience, how the exotropic, isotropia patient, that diplopia is there, no? So can feel that, so that easy for them, for the exam point of view, or for the oral exam, or for the general.
Thank you.
Thank you. Not many know that Dr. Virender is an accomplished, learned strabismologist. Any comments, Dr. Virender? We know him as the ace refractive cataract surgeon.
Yeah, I think this is very good. At least PG can feel themselves by doing it on the colleague. that what will happen when you put a prism.
Yes, sir.
Actually, otherwise it is difficult to remember. Doing practical will make it simple.
Yes.
And the good thing is that everything is available at hand. Yeah.
Great.
Thank you, sir.
In the after image test that you were showing, it was a very nice one because not many people do that. Just remember the room should be dark.
Yes, sir.
So the surround room should be
yeah.
absolutely dark. Actually, the video was showing a little bit of light.
Yeah,
So,
light is there, but
so great. Wonderful. Congratulations.